Hey everyone, welcome back to WYSTEM. ET here with Array and the Wyoming Technology Coronavirus Coalition. And we are excited to bring you part 2 of Science Week. As you probably know, this month we are celebrating science, technology, engineering, and mathematics here in Wyoming as we fight the coronavirus. And if you guys joined us on Tuesday, we have some very special guests for Science Week. We have Dr. Dan and Amy Surdam with Stitches Acute Care Centers. And tonight we're going to wrap that up. And so if you were not able to join us on Tuesday, don't worry, everything is on YouTube. So we'll have some links here on this video that you can go and watch those. And so I want to again thank Amy and Dan for taking the time out there on the front lines. They're working and helping as many people as possible to make sure that they stay healthy and safe. I also want to remind you about participation because the STEM fields are super important for career paths. And what we are going to do is we are going to offer all of you who are watching these videos the opportunity to win a 3D printer for your school. So we're going to be learning a lot about 3D printing during engineering and mathematics weeks, and you'll see just exactly how cool they are. How you win that is each week we're going to have a secret code word. That code word may have shown up in Tuesday's video, but it also may show up tonight. And then in about 3 or 4 weeks before the end of WYSTEM, you will be able to enter each of the code words. And if you get them right, we will randomly draw and we will send a awesome 3D printer to your school. So definitely make sure you keep an eye out for those code words, participate. And we also hope that you really enjoyed part 1 of Science Week, where we learned all about viruses and bacteria. So now I want to transition over back to Amy and Dan, who are going to continue Science Week, and I think we've got some really great stuff for you. So thank you for joining and enjoy the show. So Amy and Dan, thanks and welcome back to WYSTEM. We're excited to have you again.
Thanks, ET. It's great to be here.
Hi, everyone again. Hi, boys and girls. Hi, Lane and Drew. Love you.
So again, I'm Dr. Dan, and this is Amy, and we're super excited to be here with you on this windy Wyoming Thursday. This is part 2 of Science Week. Last week we talked about germs, and we're going to kind of continue that theme today and discuss what happens when our bodies encounter germs and what we can do about that. But first, we're going to go over our terms and germs. So we're going to put up a little sheet, and these are just general terms we're going to try to cover during the talk or the discussion this evening. And if I don't hit on all these terms, make sure if we have time for questions, you type that in the question box and we'll cover what they are. So the first term is going to be whole blood or blood, and the components of blood, which are plasma, platelets, red blood cells, and white blood cells. Then we're going to talk about your immune system. We're going to cover antibodies. We're going to talk again a little bit about bacteria and viruses, just to recap that in case you missed last Tuesday. And then we're going to talk just briefly about antibiotics, viruses, and vaccinations. So that kind of covers the terms and germs I'd like to just make sure we cover. But first and foremost, we're going to start with a bang. Amy's going to torture me here. She's going to draw my blood. So if you're squeamish, it's not too bad. But if you don't like blood, just try to look away. It's just going to be a little poke. And if I scream or pass out, don't hold it against me.
It'll make it really exciting.
So here we go. And we're doing this because we want to measure my blood for antibodies to see if antibodies against coronavirus.
Yeah, so we have to do a blood draw to test for antibodies. And I have all of my supplies here. And if I didn't know, Dan, and we weren't married, I would have a mask on to protect. So first, I put this tourniquet on his arm, Dr. Surdam's arm, so I can see his vein kind of come to the surface a little bit. And I want a good vein. Then I take some alcohol to clean the vein. Get it nice and clean. And I have to use the needle, and I use a special tube. And I have to use a special tube that has gel to keep the blood clotted at the end. And we have lots of different tubes for lots of different blood. So I get it ready in here. And then I'm just going to do a poke. And then I'm going to get the blood coming in my tube now. It's filling up my tube. It's almost full, so I'm going to take off the tourniquet. Doing okay?
Mm-hmm.
I'm going to get a little cotton ball. And I put pressure on that when I take that out. And that's it. Then I protect my needle because I don't want to get poked. And now I have my full tube of blood. And what we're going to do now is we're going to let this clot. It needs to clot before we spin it down. So we're going to check on this blood in about 10 minutes. And then we're going to take you and show you how we spin it down to get it separated which is what we need to do to send it to the lab. And that's how we draw blood. It's really easy. And it doesn't hurt that much, does it?
Nope, that's pretty much painless. So thank you, Amy. You're a great phlebotomist.
Thank you.
And phlebotomy comes from, anytime you hear the suffix otomy, it means poke a hole in something, and phlebe means a vein. So she's a good phlebotomist. And just a quick housekeeping note, if we're having a little bit of a glitch where it'll go blank and a question mark probably comes up on your side, we're not asking a question, it's just a glitch in the program. So we'll try to pause what we're saying and then restart once we come back on.
Yeah.
So this is, as Amy showed you, this is the blood, and basically this is called whole blood. And it has 4 components. It has red blood cells, and white blood cells, plasma, and platelets. And the human body the amount of blood that the human body contains differs on what?
On how big the person is.
Correct. So a newborn baby may only have about only a cup of blood, and our 5th grader right now is doing units and conversions, so this is perfect because an adult typically has about 1.2 to 1.5 gallons, which is how many cups?
Oh my gosh. Don't put me on the spot like that. I need paper.
It's about 20 to 24 cups of blood. So when you think about that, when you're pouring your cereal in the morning and you grab a gallon of milk, you can think like about 1.5 of those is about how much blood that the human body actually has. And blood is about 10% of an adult's weight. So do you guys know why blood looks, when you look at your skin and you look at your vessels, does it look red or blue usually?
Looks blue.
Yeah. And do you guys know why it looks blue? Well, some people like to say, well, it's because where's Spock from? So, or we're not aliens, but some people think it's because the blood doesn't have oxygen in it.
But that's not why.
But that's not why. It really has to do with how light is. It really has to do how light penetrates the skin and reflects off the skin. So red light penetrates the skin more than blue light, and blue light's reflected. And so it's kind of an optical illusion where our blood looks blue when you look at it through the skin there. So again, we're going to talk about the different components of whole blood. So let's start talking about red blood cells. And this is what actually makes your blood look red. These are the cells that carry oxygen away from the lungs into your tissues, and then carries carbon dioxide back to your lungs, and you breathe out the carbon dioxide. So they're a very important part of our blood and how we get energy. Anything else you want to add to that? Oh, so red blood cells are produced in your bone marrow. Mm-hmm. Yeah, and this is a spongy substance in between or on the inside of your bones that actually produces your red blood cells.
And when people are anemic, it's because they don't have enough red blood cells, or their blood cells are too small. Those can be some of the causes of anemia.
Correct. So anemia means low red blood cells. That's the medical term for low red blood cells. The next component of your whole blood is your white blood cells.
They're also called leukocytes.
They're also called, that's the fancy term for white blood cells, leukocytes. And these are super important, especially when we're talking about germs, because they basically act like the police. They look out for bad guys, and then when there's bad guys around, they arrest them and either put them in jail or take care of them. So they're really important when we're talking about how our bodies defend us against viruses and bacteria. And then we have platelets, which is the third component of blood. And these are actually not cells, but they're fragments of cells. And they're super important because, like when Amy just drew my blood, my body automatically starts to clot. And so, and the way it does that is the platelets actually that are fragments of cells kind of clump onto the lining of your vein and help your body stop the bleeding.
And so that's also important when you have a cut or maybe a bloody nose, that it's important to put pressure on the cut or to put pressure on your nose, because you want to help activate those platelets and you want to help those areas clot and stop bleeding as much.
Right. And then the fourth and last component of whole blood is your plasma. And plasma is mostly water. And we're going to actually be able to show you what my plasma looks like in a little bit once we kind of can spin the blood down and separate it into its different components. But it also contains really important factors like your antibodies. It contains vitamins and hormones and other things that help our bodies function. So those are the four components of whole blood. So red blood cells, white blood cells, plasma, and platelets. And then I just want to go over real quick, in case you missed last week, just really to recap, and you guys at home can talk to us probably about viruses by now and what viruses are.
Yeah.
So they're microorganisms. And the difference between a virus and other germs is that a virus requires a host. So it has to attach onto a host, be it a human, an animal, a plant, and it goes inside the host cells to reproduce. And then we have bacteria, which is the other germ we worry about that causes diseases in humans. And it's a single cell organism that doesn't have to rely on a host to reproduce. It can actually divide itself. So it doesn't have to be on a human or a plant. It can live in the environment by itself. And it may or may not cause disease. Like we talked about last Tuesday, there's good and bad. And so what happens when we get all these germs? Well, our body fights the germs with our immune system. And so the immune system is like, I kind of think of it as the big crime fighting organization. So it's not only the local police department, but it's going to call in the FBI and the CIA. And when it detects, a bad actor or a virus or bacteria in our body that shouldn't be there, it's going to activate our immune system. And it's an organization of systems in our body that work together to get rid of the diseases. And so we're going to start. ET has a video for us that the first video is going to talk about our innate immune system, which is basically the immune system that's already active in our bodies, that's fighting infections when they initially come in.
The immune system protects your body from germs. Its first defense is your skin. The skin is the body's largest organ. It covers about 2 square meters. That's the size of a basketball backboard. Microbes that attack must get through the skin first. But germs have another way to get in. Inside our bodies are damp linings called mucous membranes. Laid out, the body's mucous membranes would cover 400 square meters, the size of an entire basketball court. These line our nose, throat, intestines, and reproductive tracts. These slimy, warm surfaces are ideal for invading germs. Microbes in the air we breathe and the food we eat thrive here. It's a large area to defend. Your mucous membranes are going to need help. That's why your body has special cells. These cells evolved to fend off microscopic attackers. First on the scene are early responders. This macrophage is one type of cell. It identifies invaders, then attacks. The cell also gives off chemical signals. These signals call up support from other types of cells. This defense is not selective. It often sacrifices healthy cells. The only goal is to contain the infection. But what happens if a germ slips through? You'll need a more targeted defense.
So that was pretty cool.
I love those videos.
Yeah.
They did such a great job making those.
So isn't that amazing about the skin?
Yeah, that it's your largest organ in your whole body is your skin. So important to take good care of it.
Yeah. So make sure you put sunscreen on, and when you go outside, we really need to protect that, because as the video illustrated, that's our first line of defense when these germs are trying to get at us. Now, if the germs can also.
Or I was just going to say, also in addition to sunscreen, it's important to keep your skin moisturized, especially in Wyoming when the wind is blowing like this. You want to keep your hands covered and keep moisture on your skin.
Yeah, that's important. But the other way that the germs can get in is through our mucous membranes, right?
Yeah.
So in our nose, in our mouth, in our intestines,
and reproductive
and even
tracts.
reproductive tracts.
Yeah.
And so that's where that innate immunity really comes in handy, that the cells can detect those germs right away. Now, if the germs do get past the innate immunity, that's when our active immunity kicks in, and we'll start hearing about antibodies and that type of thing. So E.T.'s going to show you that video right now.
The adaptive immune system provides a more targeted defense. One special type of cell is the dendritic cell. This cell is like an intelligence specialist. When a germ invades, the dendritic cell collects pieces of it. The cell travels to a lymph node nearby. Here, a cascade of events begins. Inside the lymph node, the dendritic cell shows pieces of the invader to T cells. T cells are the immune system's communications team. In turn, T cells train B cells to make antibodies. These molecular weapons can target a specific invader. The immune system now mounts its next defense. B cells release millions of antibodies, each antibody shaped to identify a specific enemy. B cells send out antibodies until they wipe out the infection. In this way, the body adapts to new germs. By mounting targeted defenses, it is able to fend off most diseases. The adaptive immune system.
Wow, super cool.
Mm-hmm.
So that kind of gives you a glimpse into our active immunity and what happens once the invaders get past kind of our first line of defense, and how it's super organized, and really just amazes me every time I see that, what the human body is capable of. And it just kind of gives us a brief introduction to antibodies. And so what we're going to do now, we're going to take my blood. It's been enough time. We're going to walk you over and show you kind of what we do after we draw blood from someone. And
yeah, so you can see here that the blood is clotted. You can tell because when I turn it upside down, it's all clotted and it doesn't go to the bottom of the tube at all. So what we're going to do is go spin it now in a centrifuge. So we go to our little mini lab here. We're going to walk through the clinic. Hi, everyone. This is our team working. Say hi, everyone.
Hello.
They all have their masks on. I don't have mine on right now, so I'm wrong. I'm buzzing right through here. Okay, so this is our centrifuge right there. And I'm going to put this in here. And I have to balance it with something that's similar size and weight. Let's see. I don't really have. I need to add a little bit of fluid to this one to get it balanced. So just a second here.
So while Amy's doing that, we'll just kind of go back to antibodies. Oh, she's got it.
So you have to balance the centrifuge with the same weight and size tube, otherwise it won't spin correctly. And then I'm just gonna close it, and then I just hit start. And now you can see that it's spinning. It's spinning, and that'll spin for a few minutes. And then when we're done spinning, we'll come back. I'll just grab the tube and we'll check so we won't have to walk all the way through the clinic again. But I wanted to show you the actual centrifuge. So, okay, we're gonna go back in our little room here. There we go.
All right.
That was your field trip.
So we're back. We're back. So once that gets done spinning, we'll be able to really, it'll be cool because it'll show you the 4 different components of the blood that we talked about.
Yeah.
So just to go back to antibodies real quick. So as you saw in the video, they're Y-shaped, and they're proteins that after our bodies identify the infectious or the foreign material or invaders or germs that should not be in our body, we produce antibodies. And these antibodies can either neutralize the germ, making it difficult for them to get into our cells, or they basically act as signals and will identify these germs so other cells can come and take care of the germs. So it's a really well organized, super cool process. And right now we're checking me for antibodies to the coronavirus. So
could we, Dr. Surdam, let everyone know if you have antibodies or not?
Sure.
Next week?
Yeah, that'd be a cool follow-up. Yeah.
Okay. We'll let you all know next week if Dr. Surdam has the coronavirus antibodies or not.
Yeah. So like we talked about on Tuesday, if you have a bacterial illness or infection that's making you sick, we as doctors and nurse practitioners and other healthcare providers can prescribe antibiotics for that. So we actually have really good weapons against bacteria. If it's a virus, unfortunately, we really don't have many good medications that work against viruses because they're so small and they actually use the host to reproduce and trick us often, trick our own immune system. And so really, like we talked about, good hygiene is our best defense against these viruses and other germs.
And preventing them.
Yep.
Once you get the virus, though, the things that are important to remember is just to stay well hydrated and stay away from others when you're sick.
When you're sick, stay away from others if it's a viral infection because they're pretty contagious and they spread really easily. When you cough, you want to make sure to cough in your elbow or sneeze, and then wash your hands. But once scientists kind of get a better idea of what's causing the virus and do some more experiments, we can actually develop a vaccine. And this is one of the most important, advancements in modern medicine are vaccines, where they've saved so many lives. And we're working really hard right now to develop a vaccine for the coronavirus. We have other vaccinations for influenza, polio, other bad diseases that have really caused a lot of problems in humans. And the way a vaccination or vaccine works is we actually take a particle of the germ and introduce it. Sometimes it's live, sometimes it's dead, sometimes it's just a piece of it. But we introduce it back into our system and let our own immunity build up our antibodies and defenses against that. So next time that we encounter it, our bodies will be ready and keep us healthy and safe. So that's, the majority of what we wanted to talk about. To take it back to the coronavirus, there's really 2 ways that we in this healthcare clinic test for the coronavirus and other healthcare clinics around the nation. The first is with a molecular swab. It actually goes in your nose, and we look for genetic material from the virus.
Should I test you
No,
with the
We're
swab?
gonna pass on that tonight.
All right.
So that's the first, and that actually shows us if you have an active virus, because the coronavirus likes your nose, it likes your throat, and it likes your lungs. So that's the places that we look, and we take that swab to look for genetic material. It actually is the RNA particles from the virus that we're looking for. After you've been sick and your body has mounted a defense against it, we look for antibodies, and that's what we did tonight with me. So we drew my blood, and we're going to send that to the lab and look for antibodies against the coronavirus. ET, are there any questions out there that I can answer while she's...
Yes, we have 2 questions. So the first question comes from Miss Mitchell, and it is, can you have high blood pressure when you have COVID-19?
So that's a great question. So when you have COVID-19, it does not actually cause high blood pressure. And so it would probably be an incidental finding if you had high blood pressure along with COVID-19. Now, when you're ill and you're sick and you're not feeling well, sometimes your body's blood pressure goes up. And on the flip side of that, sometimes when you're really sick, your blood pressure can actually go way down. So, but high blood pressure is not necessarily a sign that we look for to identify COVID-19.
I have the blood. I actually, Dan's is not done being spun, but so I stole somebody else's, but it looks the same.
Yeah, I'm not going to. So here, can you guys see that at home? Ooh, right there. So on the bottom, you've got your red blood cells. And then there is, in the middle there, you can see that white stripe, and that's actually your white blood cells and your platelets. And then on the very top, that yellow fluid is actually your plasma. And so that's what you can donate if you've recovered from COVID-19, is that yellow fluid, and that contains the antibodies. So, and the platelets, so you've got your 4 components of blood. You've got your red blood cells, white blood cells and platelets, and then your plasma right here.
So we have to freeze this. We freeze this sample and send it to the lab, and they use the plasma to test for the antibodies for the COVID-19. And so that's why we have to use these special tubes and then separate it and then send it in a way where they can use the plasma.
ET, what was the second question?
Yes, super fascinating. So the second question is Avery from Anderson Elementary School. And what is the best way to get blood out of clothes?
Ooh.
Ooh, I know that one.
So Avery, great question. I'm going to let Amy answer that.
I've gotten a lot of blood out of clothes, and it's actually just by using cold water. Just washing clothes in cold water will most of the time get the blood out.
I would also add, and Amy, correct me if I'm wrong, but hydrogen peroxide also works well sometimes.
That works well too. Yeah.
All right, and then I think that right now are our only questions. So any kind of closing comments that Dan and Amy that you have that you want to kind of end and launch or kick off Science Week with?
I would just like to say thank you for having us, and thanks to all the boys and girls for watching. And you know, it's great that you're interested in science. Believe it or not, as healthcare providers, we are scientists, and we would like to encourage you to consider going into a field such as ours. The world always can use more doctors and nurses and nurse practitioners and lab technicians and x-ray technologists and people in science like we are, and we would welcome you to our profession if you're ever interested.
Yeah, and I would just like to echo that we, you know, the world needs more cowboys and cowgirls, but we certainly need more doctors and nurses and healthcare professionals, and actually any of the STEM fields are great. And we'll add art to that too.
Yes.
So we thank you guys so much for having us, and please, I hope this gave you just a little bit of an insight into our world and why we love taking care of people. And if you ever have any questions about medicine or anything else, please let us know. And I'm just going to add as well that we do know that there's a lot of asymptomatic people that do have COVID-19. So, you know, the symptoms can be really minimal, and you don't even know you have it. So if you just want to get tested, we do have enough of the supplies now to test people that are asymptomatic as well.
And when we test for antibodies, we also do test for the active disease at the same time because we want to identify those asymptomatic carriers. Except Dr. Surdam wouldn't let me test his.
Right.
All right. Well, thank you so much, Amy and Dan, for your time and explaining viruses, bacteria, how we test for COVID-19. And to their point, I actually was an asymptomatic carrier myself. So my family went through COVID-19 and I didn't experience any symptoms. And so anyone can get this. And so it's really important that you guys wash your hands, you understand what science is and how bacteria and virus transmit, and keep everyone and your family and around you safe. So thank you so much, Amy and Dan. You guys did a great job this week. And I definitely also want to give a massive shout out to vaccinemakers.org for those amazing videos that you saw on Tuesday, but also tonight. The team behind Vaccine Makers worked very quickly to get us the rights and the permission to use those videos. So thank you so much. As you guys saw, incredible production quality. You can watch more and actually get lessons on viruses and bacteria at vaccinemakers.org. So if you like those videos, please go and learn more about them. And then, obviously, at some point, whether it was tonight or on Tuesday, the secret word has shown up for week 1. So if you didn't catch it, you can obviously rewatch part 1 and part 2 here on YouTube. Again, that is so that you can win a free 3D printer for your school. And definitely what's next. So next week is we're going to be celebrating technology, and we have an amazing woman. Her name is Teal Wyckoff. She is a research assistant at the University of Wyoming, and she's going to be talking to you all about technology and mapping and how we're using all of these cool things to track a variety of different things. So you're definitely not going to want to miss next week with Teal. And then again, the week after that, we're going to have Tyler Kerr. He's going to be teaching about 3D printing and engineering week. And then to wrap up, on week 4, we have Lars Kotoff, a computer science professor at the University of Wyoming, who's going to be teaching you coding and so many other things. So there's so much more to go. So we really, truly hope that you've enjoyed week 1 of WYSTEM. We launched Monday, Science Part 1 Tuesday, Science Part 2 tonight. And we really thank you very much for all of your support, Anderson Elementary and everyone. So we will see you back here on YouTube Live Tuesday for the kickoff of Technology Week. So with that being said, have a great weekend, everyone. Stay healthy, stay safe. Hopefully you learned a lot this week, and I will see you in a couple of days. So until then, ET signing off. All right, bye everyone.